This video looks at some of the effects you get after stopping the Depo shot and why they happen. Hello, I'm Dr. Sylvia, a general practitioner with AskAwayHealth and a health educator. Thank you for joining me today. On my channel, I share health information videos that help you understand how your body works and to live well. If these are the kind of videos that you're interested in, you've jumped onto the right channel. So please make sure you like this video and subscribe. And don't forget to click the notification bell so that you know every time we publish new videos just like this. Many women use the Depo shot or Depo Provera injection as a long-term method of regular contraception. Each Depo shot contains the long-acting progesterone steroid, which slowly builds up into your bloodstream, but the effect can last well over 2 months. Having a Depo shot every 12 weeks gives about 99% effectiveness, which is one of the highest amongst the hormonal contraceptive methods. And this means if you monitored a group of 100 couples using the Depo shot correctly and consistently over the period of 12 months, only one of those couples would fall pregnant. Many women suffer significant side effects while they're having their Depo shot injections. Some of these are irregular periods, delayed or even absent periods. Other effects include weight changes, thinning bones, headaches, vaginal inflammation called vaginitis that causes soreness, skin problems, and mood changes. Some women do not suffer these effects. Still, whether you suffer side effects or not, after you completely come off the Depo shots, it is possible to experience some effects that appear to be related to using the method. But before we look at why that should happen, let's take a look at some of the features of the Depo shot, particularly how it starts working and how it comes out of your system. The Depo shot works mainly by preventing ovulation, that is the release of a mature egg from one of your ovaries every month. However, it also dries the cervical mucus, making it difficult for the sperm to travel within the reproductive channel and fertilize an egg. And thirdly, it can also thin the lining of the womb so that even if an egg is successfully fertilized, it is not able to implant to the womb tissue and grow. These effects of the Depo shot can happen within days in most women. So if you take your first injection on the first day of your menstrual cycle, as we usually recommend, by day 7, by the 7th day, the Depo shot will be effective in protecting you. And here's a tip: if you're not taking the Depo shot on the first day of your period or during your period and you've had a negative pregnancy test, we do recommend that you use a condom for 7 days to allow the hormone build up in your bloodstream and give you the protection that you require. So that's how the Depo starts working. What about when it starts to wear off? What is going on? Well, when we look at how the effects of the Depo come out of your system, it's slightly different. After you've had your Depo shot, the quantity of progesterone in your body reduces to tiniest amounts by 14 weeks after you had the injection. And this makes it necessary for you to have your next Depo shot about 12 weeks after the last one if you intend to continue this as your method of regular contraception. However, if you decide to stop it, whether you've had it just the once or you've had it for a number of doses, you can still experience effects that appear to be related to the Depo shot a considerable amount of time after the drug should have come out of your system. By 3 to 4 months after your last injection, the progesterone will have come out of your system completely. However, there can still be significant effects because of the influence of the progesterone on your natural hormones. It's because it's a big amount of progesterone that suppresses the activity of those organs that control the production of your reproductive hormones like estrogen and progesterone. During the time when you're having the Depo shot, it reduces your natural hormones so that the levels are similar to what it is, for example, if you were menopausal, and that is low estrogen and low progesterone. And after stopping the Depo shot, there are 2 clearly recognized effects which are directly related to the very, very slow return of your natural hormones to the levels that they should be, and not those menopause levels caused by having the Depo shot. One of them is the delay in getting pregnant, and the other is the effect on your bone health. We know from studies that within 10 months of the last injection, 50% of women who discontinue the Depo injection to become pregnant will conceive. In a small proportion of women, however, fertility is not re-established until 18 months after the last injection. In other words, that ovulation suppression effect of the Depo shot continues even after the progesterone has come out of your system. It's not related to how long you've used it, but an interesting observation is that women who are slimmer with lower BMIs tend to become pregnant sooner than women who are heavier with larger BMIs. It's also for this same reason, that is the low estrogen and the delay in the estrogen levels coming back to normal, that the bone health is affected, meaning that if you use the Depo shot for an extended period of time, you could be at risk of fractures or broken bones. Of course, when you stop taking the shot and your estrogen levels return to normal, bone strength also returns back to normal. These are the only two after effects from using the Depo shot where we have documented evidence that it is related to the Depo, even though the effect of the drug has come out of your system, why it happens, and the fact that things do return to normal after some time. But many women experience other effects apart from the delay in return of fertility or problems with bone health. We don't know whether these are directly related to the Depo, why they happen, and whether things will come back to normal. And I'd like us to look at a few of them in this video. So some of the examples that we'd like to consider are irregular bleeding, experiencing night sweat and hot flushes, weight gain, and abdominal cramps. While you're on the Depo shot, you might experience weight gain. Some studies suggest it's around 2 kilograms or 5 pounds in the first year. But some women also find that after they've stopped the Depo, they also experience weight gain. And here is why we think this might be happening. While you're on the Depo, like we've said, it suppresses your natural hormones. After you stop the Depo, your brain sends messages to resume hormone production by your ovaries. But instead of gently waking your ovaries up and pushing them to resume production, what happens? Things go a little out of control. So there's overstimulation of your ovaries, leaving you with erratic and high estrogen levels. That excess estrogen prevents ovulation, meaning the other sex hormone that usually comes after ovulation has been triggered, progesterone, and which usually balances out the effect of estrogen, is not being produced. And apart from affecting ovulation, high levels of estrogen also contribute to weight gain and other problems like sore breasts, fluid retention, abdominal bloating, and mood swings. So this may account for the reason why some women suffer these problems after they've stopped the Depo shot. It could be linked to estrogen levels going into overdrive and without any balance from progesterone. What about Depo after effects and bleeding? What we find is that women may have no flow for several weeks or months, continuous flow, spotting or flooding, or other irregular bleeding patterns. But why do women experience such a range of symptoms with their periods after the Depo shot has stopped? Unfortunately, we are not sure. We haven't got enough studies yet to give us a clear indication, but of course there are possible links to the irregular hormone levels that are trying to recover after the Depo shot stop. However, some scientists have made some observations that in the first few months after stopping the Depo shot, women who have no blood flow tend to be younger, have added none or little weight while on the Depo, and are under the most emotional or physical or situational stress. So they're in that group of young, thin, and stressed who experience no flow after they've come off the Depo shot. On the other hand, it appears as if those who experience a heavy or prolonged bleeding are more likely to be older, closer to menopause, and who have gained weight while they were on the Depo. If you've used the Depo shot, I would really love to hear from you in the comments section whether any of these mirrors your own experience. Now, what about hot flushes and night sweats after you stop the Depo shot? Because that's another common one that many women do mention. Well, these are symptoms usually of the perimenopause and menopause. Perimenopause is that transition period before menopause and most often starts in your 40s, although in some women it can begin earlier. The thing is, some women enter the perimenopause while they are on the Depo shot, and so the progesterone in the Depo shot can mask or cover up any symptoms they may have, such as night sweats or hot flushes. If you're in that category, when you stop your Depo shot, you begin to experience perimenopause symptoms like night sweats and hot flushing, and it appears as if it's an effect of stopping the Depo, but actually these are perimenopausal symptoms. After stopping the Depo, the list of possible effects is quite long and it varies among women. One of the most important things, and why I'm doing this video, is to let women know that these things could happen, so there isn't a panic or isn't shock to the system if they do develop, and we can look at addressing them because the majority of them do settle down and can be explained. The Depo shot is an effective form of contraception, and some women who have no problems love the method. It might also be a good option for some women who cannot use other methods like the combined pill or combined patch. For example, if you smoke, or you're over 35 years of age, if you've had a blood clot, liver problems, heart disease, or suffer from migraines. But if you find yourself in the group of women who do experience these Depo shot effects after stopping, please don't panic. Speak to your doctor first to ensure that there is nothing else that can explain the symptoms. And if they are due to the Depo, a few things could help to minimize the symptoms and treat them. If it's heavy bleeding or flooding, taking ibuprofen 200 milligrams at least 3 times a day with food can help to reduce the volume of the blood flow. Please check with your doctor that taking ibuprofen is appropriate for you. For example, some people with asthma or people who've suffered from an ulcer within their stomach or other parts of their bowel may not be able to use ibuprofen. Next, if that doesn't help, we can treat irregular periods like heavy bleeding or absent periods with courses of progesterone prescribed by your doctor till your natural flow returns back to normal. And for other symptoms that we think could be caused by excess estrogen, some of which I've mentioned already in this video, we think that natural measures or lifestyle changes could make a difference. So getting more exercise, eating more vegetables and fruits, and cutting down on junk foods and desserts, as well as reducing coffee and alcohol intake are just a few examples. Well, my friends, I hope you found this breakdown on some Depo shot after effects helpful. Please let me know in the comments section if you've got any questions or suggestions. If you've experienced any after effects that I've not mentioned here, how long they lasted and how you treated them, I would love to hear back from you. Please don't forget to like the video and subscribe to my channel, especially if you found this information helpful, and share with a friend or two who may also benefit from the information. I want to say a big thank you to everyone who's recently subscribed to my channel and making it possible for me to continue to push out these videos, the questions that you ask and all the engagement. I really appreciate it, and it makes me know that this is providing some kind of value to people out there, so thank you. And next time on the channel, we're going to be looking at questions around painful fibroids, really looking at fibroid pain, what causes fibroid pain, how it happens, what it feels like, and of course treatments to get over fibroid pain. So if this is something that you really want to know about, make sure you've subscribed and turn on your notifications, click that bell so that you know when that upload goes live. And while you're waiting for that video to come through, check out these two here, and I'll see you again soon.